A very popular topic with my patients, is cataracts. Again, another aging process that takes place where the lens in the eye, which is clear when we're born, becomes cloudy. Now, again, it's not something you can, as a patient, watch because it's a 70-year process, no different than watching the beach in Lake Michigan. You're not going to see the shoreline change, but if you were to take a shoreline 50 years later, it's going to look a little bit different in shape than it does today. Same thing with your lens. I can tell you where the status of your lens is, every year for the eye exam. But again, when it gets to a point where you're not reading small print or you're not seeing what you think you should or your spouse is seeing, and that is a time that possibly we need to look into cataracts. Cataracts are easy to remove. There's several ways to remove them, but it's a surgery where you have to penetrate the eye with a very small scalpel, right where the white part meets the colored part. And then once you get in there, you can either remove the cataract with a laser or with a vacuum procedure. The vacuum procedure is much more traumatic, if you will, to the eye. Doesn't mean it causes damage. The laser is much softer and easier to get the cataract out. These are things that I will discuss with you based on the status of your cataract after we do the eye examination. But when we do the cataract surgery, we have to put something in. So when this is ready to come out, we've got three choices of an implant we can put in. We can put an implant in that's one power. One power meaning we can put that in and pretty much correct you for distance. Some patients will have a lens that if they've worn contacts, they'll put the implant in that allows them to read out of one eye, but you've got to be successful in contacts before they would do that in cataract surgery. Some people have a lot of astigmatism, which means the eye is football shaped, and they need to put a lens that has two powers in. That's what astigmatism lens is. And that they can do that. Again, that will correct you for distance. You'd still wear reading glasses over either one of those two first implants I talked about. Your one-powered lens is typically what's covered by your health insurance. Your astigmatism, they will cover a portion of that, but you're going to spend $900 to correct that vision inside your eye because your insurance is not going to pay for that upgrade of a lens or implant. And then the third way is, and a lot of people are going for this technology, and it's really better than ever, is a multifocal or an implant that's going to give you far away your computer and then your phone. Medicine bottle, probably going to require maybe some type of reading glasses, maybe driving at night. But overall, you're going to become 90% free or independent of glasses. That procedure is $2,500 per eye and is not covered by insurance. That's your portion that you'd have to pay. So there's all kinds of different options. Not everybody qualifies for all of them. So that's something that we would discuss or you can discuss with your eye doctor based on your needs. Cataracts last forever. Once you take them out, or cataract surgery lasts forever. Once you take them out, the implant goes in, that you are done as far as the cataract coming back. Sometimes the implant and the back of the lens, which is remaining in the eye, will kind of the body says, what is that in my eye? And that capsule or the back of the implant will become hazy. Very common. 40 to 50% of these people that get that haze will have to have a laser done where it blows a hole in this capsule, if you will, so that the patient can now see through it again. People describe it as another cataract forms, but it's not a cataract. That cataract's gone. It's just a haze on the implant where a small hole is there. The capsule's remaining there because we don't want the implant to fall into the back of the eye. But when we talk about lasering this capsule, you're talking about a very small hole. So that implant is much larger going in there that could never go through the hole. So that's not an issue. Some things we're going to want to do before cataract surgery. If you wear contacts, you have to be out of your contacts for 2 weeks. We're going to want to make sure that the back of the eye, the macula, is not troubled by macular degeneration. I've had patients where I thought the cataract was the problem, but it was actually something back there, and we ended up changing gears, taking and addressing the macular degeneration instead of the cataracts. As far as the surgery goes, it's anywhere from a 10 to 12 minute procedure. uh, the eyes are never done the same day. It's usually 1 week apart. You're going to typically see the surgeon for a consult. He will schedule the first eye, and you'll be seeing the second or the first day after the surgery by either myself or the surgeon. And the second eye is on a week later, and you'll see me for that appointment. Then you will be seen 2 weeks after that to evaluate the health of the eye, how you're doing for surgery, and if you need any glasses. Quite often, a lot of people will get sunglasses because now that you have that cloudy lens out of your eye, a lot more light's getting through. You're going to be using drops for 30 days after the surgery, but that is really the only after effect. You will wear a shield typically the 1 to 2 nights right after the surgery, so you don't rub your eyes. No swimming for a week, and no heavy lifting the first couple days. Other than that, you can drive, resume your normal life